everyone. My name is Youmna Abdel, and today we're going to explore a revolutionary field that's transforming healthcare as we know it. It's public health genomics. Imagine being able to predict and prevent certain diseases before they even show up. Imagine treatments so personalized that they are tailored to your very own DNA. That's the power of public health genomics. And it's rapidly changing how we approach health on both individual and global scale. So let's start by answering some simple questions. What is public health and what is genomics? Public health is the field of science that aims to protect and prevent diseases and protect and improve the health of entire populations, while genomics is the understanding of the genetic blueprint that makes us who we are. So, public health genomics is the merging of these two fields together. By unlocking the secrets of our genetic code, we can predict how diseases will spread, pinpoint who's most at risk, and develop strategies that not only treat but prevent illness before they spread. So, why is it important uh, for for us to study the public health genomics, and why is it important to know so much about it? For one, it allows us to take healthcare from reactive to proactive state. Think about in the past, we often waited until people got sick before we acted. But now, with the genetic testing, we can identify those who are at risk long before symptoms appear. Take breast cancer for an example. With the genetic knowledge that we have now of the genetic markers for the breast cancer disease, we can identify people at high risk, enabling them to take preventive measures early, whether that means more frequent screening or other proactive steps. This shift from reaction to prevention is what makes public health genomics a game changer. But it's not just about preventing diseases. Public health genomics is paving the way for personalized medicine as well. No two people are alike, so why should their treatments be? With genomics, we can tailor treatments to each person's unique genetic makeup. For instance, in cancer care, certain therapies are much more effective if a patient has a specific genetic mutation. By matching the right treatment to the right patient, we improve outcomes, reduce side effects, and make medicine more precise than even before. It's personalized healthcare in its truest form. Now, while these advancements are incredibly exciting on an individual level, let's think bigger for a moment. What does this mean for populations? Here's where public health genomics truly shines. By studying genetic trends across entire populations, we can identify communities at high risk for certain diseases and implement targeted interventions. For example, we've learned that certain genetic factors can increase the likelihood of developing type 2 diabetes or heart diseases in specific ethnic groups. So, armed with this knowledge, the public health officials can roll out prevention programs that are tailored to those more at risk and increase their awareness, help to reduce the prevalence of these conditions, and improve the overall health of the population. As a result of the powerful impact of public health genomics, major global health organizations are already taking steps to integrate genomics into public health practice. Take, for example, the World Health Organization, the WHO. It has made it clear that genomics is key to achieving global health goals. They're pushing for countries around the world to incorporate genomic technologies into their healthcare system. While in the United States, the Center for Disease Control and Prevention, the CDC, is leading the charge through its Office of Genomics and Precision Public Health. Their focus is to use the genomics to improve public health outcomes. They've already had success with conditions like familial hypercholesterolemia, which is a genetic disorder. If left undetected, it can lead to early heart diseases. So, through the genetic screening, the CDC has been able to identify those at risk, allowing them to take action before heart disease develops. This is a real it's a real life-saving impact driven by public health genomics. Meanwhile, across the other side of the world in the UK, the NHS, the National Health Service, is pushing the boundaries of genomics even further with their genomic medicine service. They're integrating genomics into routine clinical care, guiding treatments for cancer and rare genetic disorders, and even launching population wide genomics programs. Their work is showing that isn't just for the lab, it's for the clinic, the hospital, and every community, making healthcare smarter, faster, and more effective. Now, as exciting as all this is, we must remember that genomics has broader implications for public health. By studying genomics, we're not only uncovering the genetic secrets behind diseases, but also we're giving ourselves powerful tools to understand some of the most pressing public health challenges for our times. Chronic diseases like diabetes, heart diseases, and cancers aren't just medical issues, they are public health emergencies. By understanding the genetic predisposition to these diseases, we can implement prevention strategies that save lives and reduce the healthcare costs across the whole nation. But let me here stop for a moment because we can't talk about the power of genomics without acknowledging the responsibilities it brings with it. As we advance, ethical considerations come into play. How do we protect the genetic data? How do we ensure that the benefits of genomics are available to everyone, regardless of income, race, or geography? These are questions we must answer as we move forward to ensure that genomics serves the common good and not just a privileged few. So, in conclusion, public health genomics is revolutionizing the way we understand and approach health. It's giving us the power to predict, prevent, and personalize healthcare in ways we couldn't have imagined even a decade ago. Organizations like WHO, CDC, and NHS are leveraging this power to improve health outcomes worldwide. The more we embrace genomics, the closer we get to a future where healthcare is not only smarter and more effective, but more equitable and accessible to all. Thank you.